Hi, my name is Mariel Miller, and I am a DPT student at Regis University, class of 2022. And I've created a little video here just so you can get to know me a little bit better. So I have a couple questions that I'll go through. The first one is asking me to talk about specialization areas that interest me. So I've really enjoyed my classes in manual therapies and studying MSK disorders. I think manual therapy is a really nice way to create a unique connection between you and your patient. And secondly, I was lucky enough to volunteer at Craig Hospital, which is a traumatic brain and spinal cord injury hospital in Denver, Colorado. And working with those patients was life-changing and really solidified going into physical therapy. So just expanding the expectations that those patients have for themselves. They're always so positive and uplifting despite whatever trauma they had gone through. It really inspires you to do your best every day. So I would say neuro and MSK have been really big interest points of mine through my career so far. Describe your ability to be flexible during your clinical education and strategies you use to be successful in the clinical setting. So I've worked as an aide in a PT clinic for over a year, and having been a student, most of my student tenure has been through a pandemic. I would say flexibility is of the utmost importance. When things change on an hourly basis, you have no choice but to be flexible. Luckily, I would consider adaptability to be one of my strengths. Change doesn't scare me. I can take what you have for me. So that's something that I would consider to be one of the benefits that I could bring to your clinic. How am I successful in my clinical experiences? So one of the things that I like to do is obviously set goals for my clinical experience, but I would like to set an overarching goal for the entire experience. And then I break them up into bite-sized pieces of weekly things I can do, daily things that I can do. So that's a tactic that I like to bring into the clinic to help, my clinical instructor and myself be successful. Describe examples of how you have accepted constructive feedback in class and clin ed and how you might communicate your need for feedback. So Regis, one of the best things about going to Regis University is they implement giving and receiving feedback into every aspect of every course that we take. So it's a huge component of our curriculum here at Regis. So we have a lot of practice giving and receiving feedback. I would consider myself very open-minded to feedback. I have 4 or 5 years of non-PT work experience in the business world. So doing those weekly and monthly reviews, managerial reviews, is not new for me. I welcome the opportunity to improve and, glean stuff that maybe I hadn't realized in the first place. All that stuff is great for my experience, and I just want to be the best PT that I can, and, that's a part of it. What I really like to do with my clinical instructor is have a set time on the schedule, maybe weekly, where we can sit and talk about things that maybe I need to do or things that maybe I need for my clinical instructor to be successful. So I think carving that out on a specific time on the schedule is a really beneficial thing for me to help improve. What additional preparations do I plan to do before clinical settings? Well, depending on the setting I'm going to, I like to review anything and everything I can. Regis has created a wonderful system where we can access videos of particular things that maybe we learned a year and a half ago and we might need to review it. So they've set up a wonderful system for us to be able to do that quickly, right at our fingertips. I also like to reach out to my CI and ask if there's anything specific that they would like us to review before coming into that particular setting, or is there a patient population that they work with more than others? And that's another great way for me to just feel prepared and you to feel confident in me coming into your clinic, knowing that I know what I'm doing. So, what are my goals for after graduation? My ultimate goal is to find a position that can offer me mentorship and growth opportunities. Being in a place that is supportive and has a strong knowledge base that you can bounce ideas off of people is really important to me. Furthermore, more specifically, I'd really like to hone in on my manual therapy techniques, and I'm really looking forward to, learning some skills like dry needling. So I would say those would be my goals post-graduation.